In the high-stakes world of presidential transitions, Donald Trump's team is playing a dangerous game of political roulette. As he prepares to return to the White House, his transition process is unfolding like a high-wire act without a safety net. Imagine taking control of the most complex government machinery in the world, with zero preparation. That's exactly what Trump's team is doing right now. Typically, transition teams dive deep into federal agencies by mid-November, getting a crash course in operations, budgets, and potential challenges. But Trump's team? They're barely sending names to landing teams as January approaches. The health sector reveals the most alarming picture. Trump's nominees read like a cast of television personalities and controversial figures: Dr. Mehmet Oz for Medicare and Medicaid, Dr. Janet Neshiwat as Surgeon General, Dave Weldon at CDC, Marty Makary leading the FDA, and the ultimate wildcard Robert F. Kennedy Jr. as Health and Human Services Secretary. Here's the kicker: none of these individuals have significant executive branch experience. Zero. Zilch. They're walking into agencies managing trillion-dollar budgets and hundreds of thousands of employees with essentially no governmental management background. Kathleen Sebelius, former HHS Secretary under Obama, didn't mince words. They're operating at a severe disadvantage, she warned. These aren't just routine government roles, these are critical positions managing national health infrastructure during potentially volatile times. The transition delays aren't just bureaucratic inconvenience. They represent real risks. The incoming administration faces immediate challenges: a brewing avian flu outbreak, potential resurgences of childhood diseases, and complex health policy landscapes that require nuanced understanding. Former Surgeon General Jerome Adams captured the potential disaster succinctly, warning they might be distracted with outbreaks for 4 years this time instead of 1. This isn't political hyperbole, it's a genuine concern about preparedness. Trump's approach isn't new. In his first term, he famously discarded transition work prepared by Chris Christie and ignored comprehensive pandemic preparedness documents. The consequences? A chaotic COVID-19 response that became a defining moment of his presidency. The current transition's peculiarities are equally concerning. Trump is running the transition using private funds, private facilities, and private email servers, an approach that complicates standard information sharing protocols. Agencies can't simply dump sensitive information onto potentially unsecured networks. Conservative allies are even expressing reservations. Kristen Hawkins from Students for Life noted the need for experienced hands who understand complex policy landscapes, particularly around contentious issues like healthcare and abortion access. Democratic strategist Chris Jennings highlighted the most critical risk: national health security. You can't afford to play around with viral, microbial, and chemical warfare threats, he stressed. These aren't areas where on-the-job training is acceptable. The potential impact extends beyond immediate health responses. With Affordable Care Act tax credits set to expire in 2025, even passive resistance could dramatically reshape healthcare access. Leslie Dock from Protect Our Care warned that simple administrative delays could cause millions to lose insurance coverage. Tom Scully, a former CMS administrator, emphasized the critical need for incoming officials to build relationships and understand existing infrastructures. His advice to Dr. Oz? Sit down with current administrators, understand their agendas, and find common ground. As January approaches, Trump's transition team stands at a crossroads. Will they rapidly get up to speed, or will their lack of preparation create vulnerabilities in America's most critical systems? The stakes aren't just political, they're about national preparedness, public health, and potentially, human lives. One thing is certain: this isn't a typical transition. It's a high-stakes gamble that could reshape American governance in ways we're only beginning to understand.